I'm going to call the meeting to order and ask you all to rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America
and
and to the republic
for which it stands,
one nation, under God, indivisible,
with
with
liberty and justice for all.
justice for all. Okay, let's see if I can get set up here. Okay, well, welcome everyone to the October 28th, 2020 regular meeting of the Washington Township Hospital Healthcare District Board of Directors. To comply with the Alameda County Order Number 20-15 as revised on October 23rd, 2020, to slow the spread of COVID-19 and to maintain restrictions on movement and public gathering, this meeting will be conducted by Zoom. I ask you that you please mute your system until such time as you need to speak. Governor Newsom's Order N 2920 explicitly waives the Brown Act provision that requires the physical presence of members, the clerk, or of the public as a condition of participation in or a quorum for a public meeting. We continue to comply with the Brown Act in providing dial-in information in order to provide the public the opportunity to attend the meeting. Public notice for this meeting, including dial-in information, has been posted appropriately on our website. We are recording tonight's regular session of the board meeting. It will be posted to our website for future viewing. Members of the public are invited to speak during oral communications. When prompted, please state your name for the record, then proceed with your statement not to exceed 3 minutes on issues or concerns not on the agenda and within the subject matter of the jurisdiction of the board. Are there any members of the public attending this meeting who would like to speak? Okay, hearing none, we will continue. Dee, would you please take the roll?
Director Wallace.
Present.
Director Nicholson.
Present.
Director Yee.
Present.
Director Epen.
Present.
Director Stewart.
Present. Okay. All right.
I was following directions. I was muted.
Okay. Are there, I assume there are no oral communications. So Dee, are there any written communications?
No, there are not.
Okay. We will now move to the consent calendar. The consent calendar consists of those agenda items that the board will approve with one motion unless either a member of the board or a member of the public requests to remove an agenda item from the consent calendar. If any items are removed from the consent calendar, the board will take action on the removed agenda item later in the meeting under the action item heading of the agenda. Does anyone on the board want to remove an agenda item from the consent calendar? Does any member of the public want to remove an agenda item from the consent calendar? Okay, may I have a motion to approve the consent calendar item A?
Mr. President, in accordance with district law policies and procedures, I move that the Board of Directors approve the consent calendar item A.
Thank you. May I have a second?
Second.
Okay. All right, Dee, would you please take the vote?
Director Wallace.
Aye.
Director Nicholson.
Aye.
Director Yee.
Aye.
Director Epen.
Aye.
Director Stewart.
Aye.
Okay, well, thank you all. We will now move to the presentations. Kimberly, please.
Yes, I'm going to turn it over to Chris Henry to do the introduction, but this evening we will begin with a presentation of our annual audit by Will Codd and Sarah Ramos from PricewaterhouseCoopers, but I'm going to have Chris Henry do the introduction.
Yep, and our new auditors have completed their audit of the 2020 fiscal year 2020 financials for the healthcare district, and I'm pleased to say that PricewaterhouseCoopers intends to issue an unqualified opinion on those financials. There were several adjustments that were immaterial, but several adjustments booked as a result of their audits this year, and Will and Sarah will walk you through those. These were largely technical changes consisting of several reclassifications in our financial statements and changes to footnotes. I want to note that none of these changes impacted our balance sheet, our change in net position, or our net cash flows. I did spend some time walking through the adjustments with Moody's Investor Services, who rates our bonds. Went through the details of these adjustments, and their opinion was that these were insignificant and had no impact on their opinion of their rating on our bonds. So, all that said, let me introduce our new audit team from PricewaterhouseCoopers. Will Cobb is an assurance partner with PwC based in San Francisco. Will has 22 years of experience serving clients primarily in the healthcare, nonprofit, and government industry. With Will tonight is Sarah Ramos. Sarah is an insurance director with PricewaterhouseCoopers based in Los Angeles. Sarah has over 11 years of experience serving clients primarily in the healthcare industry. With that, I'll turn things over to Will and Sarah to walk you through the audit results.
Thank you, Chris, and pleased to have an opportunity to meet with the board this evening to discuss the results of the district's 2020 audit. And I'm going to ask for Sarah's assistance in displaying our presentation, which we will walk through with you. And please, if there are questions or comments as we go through the presentation, please feel free to speak up, or we'll be happy to address any questions or comments at the conclusion as well. Okay, so we may proceed. Yeah, so I'm going to start out just with some quick summary comments. You all, I believe, have been provided access to the draft financial statements, which includes management's discussion and analysis, which is a fairly detailed summary and explanation of the trends and changes for the district's 2020 fiscal year. We have a couple of summary slides here. And what you're seeing here is the summarized statement of net position for the district, and just a couple of things to point out on the statement of net position in terms of year-over-year trends. First of all, you see an increase in long-term investments and restricted funds, and if you look at the statement of cash flows, you'll see there's an excess of investment purchases over investment sales during the year, which is part of the reason for the increase in investment funds that are held. Another item that jumps out as a significant change is the increase in current liabilities, and that's primarily driven by Medicare advance payments that were received by the district as part of the coronavirus relief funding that the federal government provided. And so those Medicare advances were provided in essence in advance of related patient health care service for Medicare patients. And so it gave the district the ability to utilize the funding, but there's an expectation that Medicare will recoup those funds through essentially a reduction in future payments on Medicare related services. So that's the increase in current liabilities. And then one other item is there's a somewhat of a decrease in the net pension, net post-employment medical benefit obligation, and other long-term liabilities, and that's primarily driven by the reduction in the net pension liability, which is primarily driven by a relatively strong investment return on pension assets. And that change in the net pension liability is disclosed in detail in the footnotes to the financial statements. So we can move to the next slide. Next is the summarized statement of revenues, expenses, and changes in net positions of the district for the fiscal year. And as might be expected, there is a reduction in net patient service revenue, and accordingly a reduction in total operating revenue. Certainly, a coronavirus impact in the fourth quarter of the year is a contributor to that. And I'll also say, when you look at the non-operating revenues, there's in a way an offsetting increase, and that is due to the receipt of certain grants and relief funds associated with coronavirus, really in an effort to stem the negative financial consequences of the coronavirus. According to governmental accounting standards, those amounts received that are recognized as revenue must be recorded as non-operating revenues. And so it's just a geography difference between operating and non-operating that's driving those two line items. Okay, can move forward. Some highlights on the audit. We've substantially completed the audit. There's a couple of items which I would say are really housekeeping in nature that we expect to have open at this point in time, such as the receipt of the management representation letter. But we expect to issue an unqualified opinion on the district's financial statements. And as far as significant changes to the audit plan, there are, as I mentioned before, certain coronavirus relief funds that the district received. Among those are the CARES Act provider relief funds. And HHS, since our audit commenced, has actually a couple of times issued new guidelines surrounding the eligibility requirements and how amounts should be calculated under the eligibility requirements associated with the provider relief funds. Those updates occurred subsequent to the fiscal year end of the district. And accordingly, the district determined that they are what are called type 2 subsequent events from an accounting perspective, which means that, in essence, you don't go back and use that hindsight and re-perform the accounting as of June 30th. So those items are disclosed in management's discussion analysis and in the footnotes to the financial statements. Those are type 2 subsequent events. We'll talk a little bit more about those funds as we move forward in the presentation. No other significant changes to the audit plan. In the findings column, no current uncorrected misstatements for fiscal year 20. There's one item that we'll talk about related to fiscal 19, which was not corrected because of the way that the matter was resolved, which I think was resolved in a very sensible way, and we'll talk about that. No material weaknesses identified. As Chris mentioned, there are certain audit adjustments related to presentation and disclosure matters, and accordingly, there's a related aggregated internal control finding, which I'll discuss in a few minutes. Okay, highlights, I mentioned this before. Districts received provider relief funds under the CARES Act, which are intended to reimburse the district for healthcare related expenses and lost revenues attributable to the coronavirus. As I mentioned before as well, Medicare accelerated advance payments were received. So certainly not only just the direct impact of COVID-19 on the day-to-day patient service and operations for the healthcare enterprise, but also this congressional funding has significant impact as well. As far as other significant transactions, we'll discuss in a little bit later the Warm Springs joint real estate purchase and the accounting conclusions associated with that real estate purchase. More highlights, independence. We have no issues to report to you with respect to our independence of the district. We maintain our independence. In terms of the scope of work, the OMB and HHS have indicated that these provider relief funds the district received are subject to federal compliance audit requirements, sometimes referred to as uniform guidance compliance audit requirements. And so absent any changes moving forward, the district will be subject to a separate compliance audit and an audit opinion over compliance will be required. And that audit will have to be submitted to the federal government there will be a March 31st, 2021 deadline associated with that compliance audit. The specific audit procedures to be performed have not yet been released by the OMB. And so we're kind of in a wait and see mode at this point. Hopefully we'll know more in the month of November about the scope of work essentially associated with that. But that's just one item to keep on the radar screen for the future. And I know Chris and his team are excited about, having the auditors around, for another part of the year doing that work. Then lastly, just, communication and coordination with specialists. And I will say, in this particular environment that we are all living in, it was important for us to harness the power of technology and utilize technology enablement in order to facilitate the completion of an audit in essentially a remote work type environment. I'm happy to report that I think that came off pretty successfully and allowed us to work and collaborate and receive information and work through it in a remote fashion. So pleased with that. Okay, audit results.
All right, so getting into the status of our audit, as Will already mentioned, we have just a couple of housekeeping matters to complete, which just relate to certain keeping current procedures and receipt of the management representation letter, which are pretty normal outstanding items at this point in time. And as Will mentioned as well, we expect to issue our unmodified report upon receipt of the management representation letter and those other keeping current items. You can see a draft of the audit report in the appendix to these materials. Now just getting into the work that we performed during the audit. So as you might imagine, there are a number of different areas that we focus on for purposes of the audit, but here highlighted on this side are two significant risks. So areas where we spent more time and attention. The first being the risk of management override of controls. One thing to note here about this risk, as well as the second risk identified on the slide, is that both of these are presumed significant risks under the auditing literature. So the presence of these risks, these exist at every audit engagement and client that we audit. So nothing necessarily to be concerned about from that regard. The risk of management override of controls, basically what that means is just that management is in a unique position to perpetrate fraud due to the fact that management designed the control environment and obviously has a very unique and in-depth understanding of those controls. And we'll talk about some of the procedures we performed to address that risk. The second risk relates to the valuation of patient accounts receivable, which is a very standard risk in the healthcare environment. We've even just drilled down even further. We have several years of hindsight and working with management, understanding their valuation model. So given the fact that it's produced historically accurate results, our significant risk is really focused on any adjustments that management may make outside of that model. So introducing any judgment or potential bias. On this slide, you can see the response to the first significant risk that I talked about, management override of controls. So some of the procedures that we perform to address this risk include, performing fraud inquiries with various levels of management. We also varied the nature, timing, and extent of our audit procedures to introduce an element of unpredictability into the audit. We also reviewed significant accounting estimates such as AR valuation, looking for potential management biases, noting no inappropriate adjustments, or and concluded that all estimates were reasonable. We also tested journal entries. So we actually looked at 100% of management's journal entries that were recorded during the year, and using our technology tools, we're really able to focus in on any journal entries that might be deemed to be inappropriate. And based on all of our procedures to date, we identified no instances of fraud at the district. On this slide, this highlights some of the key procedures that we performed related to accounts receivable valuation. The one key test that we perform in this area is looking at cash receipts subsequent to the balance sheet date. And for purposes of the audit, that's the window, the 75-day window between July 1st, 2020 and September 15th, 2020. So looking at cash collections during that time period that related to accounts receivable that was outstanding at June 30th, 2020 to try and liquidate that outstanding receivable balance. And as you can see at the bottom section of the chart on the screen, the district collected 73% of the $62.8 million patient accounts receivable balance that was outstanding. Now you'll notice that percent is slightly reduced from the prior year percentage of 81%. We did dig into what the underlying reason for that was, and really it was just attributable to the fact that there was a larger percentage of governmental payers in the June 30, 2019 accounts receivable balance, which pay quicker than other commercial and managed care payers. With respect to the uncollected balance at September 15th, another procedure that we do is we actually look at the results of hindsight. So how did management's estimation work out last year? And when you look at the 12-month collection rate on the 2019 accounts receivable balance, the district's AR was 97% collected, so very close to what they had estimated. So having that perspective of hindsight and understanding the composition of the current year AR, as well as just the current year collection trends, we've determined that the accounts receivable balance to be appropriately stated at June 30th, 2020. On this slide, you'll see that we have more information here on the CARES Act funding that Will spoke about in his introductory comments. So under the CARES Act, the district received $29 million in provider relief funds. And in addition to that, the district also received $57 million in Medicare accelerated and advanced program funds. With respect to the provider relief funds, those funds, as management understood at the balance sheet date, were intended to compensate the district for lost revenues or incremental expenses due to coronavirus. And to determine their entitlement and eligibility for those funds, the Department of Health and Human Services had put out various guidelines in the form of FAQs to help inform our accounting judgments. And in those FAQs, they had indicated that healthcare organizations could use any reasonable method to calculate lost revenues, including looking at budget to actuals for the period of when coronavirus became a national pandemic in mid-March throughout the rest of the fiscal year, and comparing that to the budgeted revenues for that time period. Another alternate method that the FAQ document suggested was a reasonable approach was actually looking at the actuals in the current year compared to the actuals in the prior year. The district determined to perform its lost revenue analysis utilizing the first approach, so looking at actual revenues in fiscal 20 compared to budgeted revenues during that mid-March to June 30th time period. And we have determined that management was entitled to and eligible for the entire $29 million received. So as Will mentioned, you'll see that recorded within non-operating revenues. Now, subsequent to June 30th, HHS has put out a series of updated reporting requirements. The first issued on September 19th clarified the rules and also changed them fairly drastically. So the rules indicated that no longer would a healthcare provider be calculating the amount they were entitled to using lost revenues, but it was defined as a negative change in year-over-year net operating income from patient care related sources. So a very different metric from net revenues. Subsequently, on October 22nd, in response to concerns related or raised by healthcare providers, HHS amended the reporting requirements again and has actually now reverted back to defining lost revenues as being measured by a negative change in year-over-year actual revenue from patient care related sources. So a lot of changing guidance. Ultimately, both sets of this guidance are treated as type 2 subsequent events, which, as Will mentioned, are non-recognized subsequent events. So doesn't necessarily change the amounts that were recorded in the income statement, but rather are disclosed. So you'll see that within the MD&A as well as in the footnotes. The other piece of this was the Medicare Accelerated and Advanced Payment Program. So that was intended to be a source of working capital funding for healthcare organizations. To audit that, we vouched the $57 million that was received back to bank statements and determined them to be appropriately recorded as a current liability on the district's statement of net position. Now, subsequent to June 30th, there's also some guidance which basically redefined the recoupment period related to these funds. So as Will mentioned, these funds will be recouped through the performance of future services for Medicare patients. Initially, that was to be repaid within several months after receipt of these funds. However, the time period has been extended beyond that. And that change in the guidance is we determined was a type 2 subsequent event. So those amounts remain as current liabilities. However, if the guidance had been applied to the 6/30 balance sheet or statement of net position date, that a portion of those funds would have been classified as a long-term liability.
Okay, I'll just briefly mention the Warm Springs joint real estate purchase. This is a joint real estate purchase in March. So during the fiscal 2020 fiscal year, a joint purchase with UCSF, and there's a joint tenancy in common arrangement between the district and UCSF associated with this real estate. So we did evaluate the accounting for the district for this transaction for the 2020 fiscal year. And actually, as part of that, we consulted with our national office. We did conclude that the accounting that was recorded in terms of accounting for this as an other non-current asset is appropriate as of June 30th, 2020. As this arrangement evolves and if additional agreements or arrangements are executed associated with the real estate, we will revisit the accounting for any potential implications or changes in that accounting for the fiscal 21 and beyond. Okay, so at this point, there are a few adjustments that I'd like to just walk through briefly associated with both the current and the prior year. During the performance of the audit and review of the financial statements and disclosures, there were certain items that were identified that were incorrectly presented or classified both on the financial statements as well as in the footnote disclosures. And so we'll walk through those over the next couple of slides here. First, on the face of the financial statements, the first item actually impacts the statement of revenues, expenses, and changes in net position, as well as the cash flow statement for the district. And this is for contribution revenues that are coming from the fundraising foundation to the district. And in the district column, or that primary government column of the financial statements, those contributions are to be reported as not operating items, and so not operating revenue, and they are reported as non-operating revenues or below non-operating revenues, depending on whether they are capital in nature or non-capital in nature. So these items had been reported again as operating revenues, and so what you see here in the current year and the prior year is essentially geographically moving these items into other sections of the statement of revenues, and similarly on the statement of cash flows, moving certain amounts to the capital and related financing section of the cash flow statement. So this adjustment has no impact on total assets or total net position or change in net position or in total cash flows to the district, but it affects certain subtotals. And so that's why this item was corrected and revised in the prior year and corrected as a result of the audit in the current year as well. The second item is on the statement of cash flows, specifically the investing section of the statement of cash flows. And what we identified is certain investment purchase and sale activity was inappropriately being netted down on the statement of cash flows. That had no impact on total cash flows or total cash flows from investing activities. It merely had an impact on two individual line items within the investing activity section that are offsetting amounts. And so investment purchases and sales have been increased as a result of this revision. And you see the amounts that have been increased by for the prior year and the current year. Again, no impact on total investing cash flows for that line item. Okay, the next page includes a few footnote disclosure items. These are footnote only in nature, and so no impact on any of the face of the financial statements for these items. The first two line items relate to the fair value levels that are disclosed for certain investment-related assets, and so governmental accounting standards require the district to classify each of their investment holdings, and similarly the foundation, the fundraising foundation, to classify its holdings as in this fair value hierarchy is either a level 1 investment, a level 2 investment, a level 3 investment, or a net asset value investment. And a couple of these items were reclassified that related to the local agency investment fund, which is held by the district. There's a related participation arrangement that the fundraising foundation has with the district for some of its monies, and so there was a reclassification in the prior year and in the current year from a level 2 to a net asset value or NAV classification. Again, this didn't impact total investments, merely the classification of certain items in that table in the footnote. And then on the second row, similar type item with fair value leveling, but this is associated with the district's pension assets. And so there was a certain investment that is a mutual fund asset in nature that has been reclassified from a level 2 to a level 1 investment. And that level 1 signifies as a readily determinable fair value. I would say, related to these investment holdings, the levels for the pension assets and for these local agency investment fund assets, they're generally considered to be very low risk type assets in nature. And so the leveling designations here are not concerning to me from that standpoint. Two more items on this page. There's a employee benefit plan disclosure related to the other post-employment benefit obligation. It's an extensive footnote in footnote 10. There's one piece of information in the prior year that was corrected related to covered payroll amounts that were disclosed. This correction has no impact on the net other post-employment benefit obligation recorded in the financial statements. This is merely a clerical correction of some supplemental footnote information. And then the last item on this page is footnote 13, which is a new footnote for the district related to the district's blended component units. So under governmental accounting standards, the district's blended component units, which are Washington Township Hospital Development Corporation, the Washington Township Medical Foundation, and the Washington Outpatient Surgery Center, LLC. Those are required to be presented, their financial information is required to be presented in a condensed financial table in the footnotes to the financial statements, and we determined that information had not previously been disclosed. And so what you see in the current year financial statements is that there's a comparative disclosure that has been included as footnote 13, blended component unit information for those blended component units of the district. It's just a footnote in nature. Okay. One last item on adjustments and changes. I'd previously referred to an uncorrected misstatement related to 2019. This item relates to the cash flow statement for the fundraising foundation. There was certain amounts recorded as donations from the foundation to the district, which in the prior year financial statements had been reported as a non-capital financing in nature. Because the fundraising foundation's principal business is fundraising and distributing those funds should have been included as an operating cash outflow to the district in that foundation column. But the district determined that the cash flow statement is not a required statement, not a required financial statement for its discretely presented component unit, which is the fundraising foundation. And accordingly, the cash flow statement for the foundation has been removed in the 2020 financial statements. So there is no comparative 2019 cash flow statement. It's simply been removed as permissible under governmental accounting standards. And so that's why the item was not corrected. It's simply the statement was removed. So control implications of these matters, we did determine that there were control implications associated with the misapplication of accounting principles under governmental accounting standards associated with these presentation and disclosure matters. These matters have been aggregated to meet the definition of a significant deficiency. And a significant deficiency is not a material weakness, but it is a deficiency in internal control over financial reporting that warrants the attention of those charged with governance, i.e. the board in this case. And so we're bringing this to your attention and communicating it to you related to those items. I do want to be clear as it relates to all these adjustments that have been made. There were no indications that there was any malintent or intentional mispresentation by management. No indications of fraud associated with any of these matters. And as I mentioned before, none of these matters impacted the statement of net position or the total changes in net position for the district. They were evaluated by the management team, and management documented in the form of what's called a SAB 99 analysis using some SEC parlance to evaluate the quantitative and qualitative impacts of these items. And management determined that the impact of these items was immaterial to the 2019 financial statements. And accordingly, the items have been revised in the current year financial statements. There is not a restatement of the financial statements, merely a revision. And we received the SAB 99 analysis and the memo from management, and we concurred with the conclusions of management associated with the immateriality of these impacts. So that concludes the control matters, and I will turn it over to Sarah for some other required communications.
All right, so on this slide and the next slide, we've included our required communications. I won't highlight all of these, but just to go over a few of them here. So with respect to other material written communications, you'll see that we do have a draft of our audit report included as Appendix 1. However, other material written communications will work with the management team to make sure that the board has access to those materials. So things like a copy of management's representation letter once it is executed and signed. As I mentioned, going through the discussion on management override, we did not identify any potential or known fraud, and there were no indications of management override identified through any of our audit procedures. With respect to non-compliance with laws and regulations, we noted none, and no other matters that warrant the attention of the board. And as Will discussed, we have performed an evaluation of the presentation and disclosures included within the financial statements and determined them to be in conformity with GASB accounting standards. And, other than obviously the presentation and disclosure matters that he had mentioned from a revision standpoint.
Okay. I think we've included a draft of the audit opinion. As Chris mentioned earlier, it's anticipated to be an unqualified opinion, and so it's very standard in nature. There's other material communications that we received during the performance of the audit. We will receive the management representation letter, and I previously mentioned management SAB 99 memo. At this point, I think that concludes our planned remarks and would certainly open it up for any questions or comments.
Thank you, Will and Sarah. Any questions or comments from any board members? Kimberly, you or Chris have anything you want to say or add?
I just want to, thank Will and Sarah for, I know this was the first of the beginning of our relationship, and appreciate the time that both of you spent in terms of getting to know the organization and the finance and the team, and also wanting to thank Chris Henry and his team for all the work that they have done in terms of getting to know the two of you and really being able to provide the information that you need. So we look forward to continuing to work together on many initiatives that I know are coming up.
Thank you, Kimberly. And I would agree with that, and certainly appreciate the assistance of management in fulfilling all our related audit requests. Audits are not necessarily the most pleasurable experiences for an accounting team especially, but certainly receive the full cooperation of management in fulfilling those requests throughout the audit process. Thank you.
Well, thank you. Will, both you and Sarah explained the situation and the audit very thoroughly, and I know that we all appreciate your explanation. So thank you very much.
Okay. Thank you.
Yeah. So then we are now going to move on to the community needs assessment.
I know there is the action item, Mr. Wallace, on the agenda. We can do it later. I don't know, Will and Sarah, if you feel you can drop off, or we can do the action item now. I wasn't sure if they wanted to wait or not.
Oh, okay. Oh no. Well, let's take care of that. And that's a great suggestion. So, can I have a motion for consideration of the annual audit?
You're on mute, Dr. Nicholson.
Well,
Yeah, I'm getting there.
there you go.
Okay, item A, audit report for fiscal year ending June 30, 2020. Mr. President, I move for acceptance of the audit report for fiscal year ending June 30th, 2020 as presented, and that the secretary be directed to publish the report in accordance with applicable law and hospital policies and procedures.
Thank you. Can we get a second?
A second.
Thank you, Jean. All right, Dee, would you please take the vote, please?
Director Wallace,
Aye.
Director Nicholson,
Aye.
Director Yee,
Aye.
Director Epen,
Aye.
Director Stewart.
Aye.
Oh, okay, that motion passes. Thanks again to Will and Sarah.
Thank you.
And
Okay.
we will now move on to the community needs assessment.
Thank you, Will. Thank you, Sarah, for joining us.
Okay, we'll sign off then.
All right. Good evening.
Okay, bye-bye.
Thank you.
Thank you. All right, the other presentation this evening is, we have Angus Cochran and Lucy Hernandez here this evening. And as you know, at our last board meeting, the two of them presented the 2019-2020 Community Needs Assessment. And the follow-up that we discussed was there is an actual plan that has been developed and has been included for the board. And this evening, I will turn it over to Angus to give and Lucy to give a short overview, but then it is really for the board to ask any questions, and then if they are so ready, we could take action on it. So, but I will turn it over to Angus and Lucy.
Well, thank you, Kimberly. Yes, we're back with our health improvement plan following the community health needs assessment presentation. Thanks for having us back. The 2020 Community Health Needs Assessment will be on the website very soon. This is really a follow-up to the assessment. We've got the health improvement plan that I believe you've received in your packets last week. The plan shows the strategy that the health system plans to pursue for the next 3 years to implement the findings of the assessment. And the plan basically focuses on the following health needs: behavioral health, housing and homelessness, healthy eating, active living, healthcare access and delivery, the social determinants of health, diabetes, heart disease, hypertension and stroke, and respiratory health. So really, we're here this evening to answer any questions you might have about the plan, and we plan to disseminate it around the district at the different cities and municipalities and civic groups to let people know what we found in the plan. Any questions at all?
Well, it sounds like that the board feels like this plan is comprehensive in terms of moving forward to address the identified areas in the community needs assessment.
Yes, I have no questions. Any other board members have any questions or comments?
No.
Oh.
All right, well, then we can move on to that as an action item.
Thank you. Thank you, Angus and Lucy, both of you. Can I have a motion for action item B? I think, Dr. Nicholson, you might be on mute again.
Uh-oh. He's figuring it out. There you go.
Can you hear me? Or can you hear me now?
Yes.
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 Oh, I'm juggling screens. Mr. President, item B, in accordance with district law, policies, and procedures, I hereby move that the board approve the 2020 Community Needs Assessment Health Improvement Plan at the board, authorize the Chief Executive Officer to move forward with its implementation.
Thank you. Can I have a second for that?
I'll second.
Thank you, Jeannie. Dee, would you please take the vote?
Director Wallace,
Aye.
Director Nicholson,
Aye.
Director Yee,
Aye.
Director Epen,
Aye.
Director Stewart.
Aye.
Angus and Lucy, I just want to compliment you on very, very thorough plan, and we've got a lot of work ahead of us, and I know we're quite capable of executing that plan. So thank you.
Thank you.
Thank you, Mr. Wallace. And I really just want to thank Lucy, who did the majority of the work on this assessment and plan. And so thank you, Lucy.
Thank you.
Yeah. Thank you both for your hard work. Thank you, Lucy.
Have a good evening.
All right.
Good evening. Good evening, Lucy. Okay, now we're going to come to an action item that I will have to discuss with you. I will be recusing myself from participating in action item C, as I am the chairman of the board of Fremont Bank, and this action item involves Fremont Bank. The first vice president, Dr. Nicholson, will chair the meeting on this item. I will now log off from the meeting Please let me know when the item has been heard and I will sign back on into the meeting. Thank you.
All right. Thank you, Mr. Wallace. All right, Dr. Nicholson.
Okay, good. With the recusal of Mr. Wallace, the board will now consider item C, ambulatory surgery center commercial loan guarantee. And if I could have a motion.
Mr. Vice President, in accordance with the district law policies and procedures, I hereby move that the board, one, authorize Kimberly Hartz, Ed Van, and Chris Henry to execute the commercial guarantee on behalf of the district. Two, authorize Dr. Bernard Stewart, Secretary of the Board, to execute the governmental certificate related to the commercial guarantee. And three, authorize the Chief Executive Officer of the district to take any and all actions necessary to execute any and all instruments and to do any and all things deemed by her to be necessary or desirable to carry out the intent and purposes of this motion.
Thank you, Director Yee. Do we have a second?
Second.
We have a second from Dr. Eapen. Kimberly, can you give us some background on this item?
Yes, I'd be happy to. So let me tell you a little bit about the situation. In November of 2019, the Washington Township Hospital Development Corporation agreed to participate in the ownership and operation of an ambulatory surgery center at 350 Marine Parkway in Redwood City, California. The purpose of opening the ASC in Redwood City is to expand the operation of the Institute for Joint Restoration and Research and provide easier access for our outpatients. Given the quality of the program, the IJRR has attracted patients beyond the normal service area of the district. Recently, the federal government, as we are aware, has taken steps to require more of these procedures to be conducted on an outpatient basis by refusing to pay for these procedures on an inpatient basis. The IJRR's outpatient procedures are currently being performed at Washington Hospital and the Washington Outpatient Surgery Center, in which DEVCA owns a 51% interest. However, patients are, in general, less willing to travel the same distance to receive outpatient surgery as compared to inpatient surgery, which has caused the IJRR to explore opportunities to expand its reach by opening a facility on the peninsula to serve its traditional patient base that lives outside of this area. The construction of the tenant improvements are underway. When completed sometime in the next 2 months, the ambulatory surgery center will include 2 operating rooms and related facilities. The operating company has obtained financing from Fremont Bank to cover the cost of the tenant improvements in the amount of $9.4 million. As the operating company is a new entity, Fremont Bank requires that the loan be guaranteed by the district, the holding company, and the current physician investor. So tonight we have before you to the board to approve the execution of the documents entitled Government Certificate by the Board Secretary, Dr. Bernard Stewart. The government certificate represents that the district is a governmental entity and the Chief Executive Officer, the Chief Executive Vice President, and the Chief Operating Officer and the Chief Financial Officer are authorized to enter into agreements related to the commercial guarantee. We're also asking the board to approve the execution of the commercial guarantee by the Chief Executive Officer, the Executive Vice President and COO, and the Chief Financial Officer. The operating company will be responsible for loan payments. It is anticipated that the cash flow from the ASC will fully fund the loan payments. Are there any other questions?
Thank you, Kimberly. It seems appropriate and reasonable to help move this important initiative forward. Are there any questions from the other board members? Seeing none. Dee, if you could call the roll.
Director Wallace, Director Nicholson,
Aye.
Director Yee,
Aye.
Director Eapen,
Aye.
Director Stewart.
Aye.
Thank you. The motion passes. Dee, if you could notify Mr. Wallace that we've completed consideration and action on this item, and we would be pleased to have him rejoin the meeting.
I've just texted him.
Let's see how fast he is on the trigger.
Yep.
Some of us fumble more than others. My apologies tonight.
No, it's not easy. All the technology that we have to maneuver.
Well, we're blessed that we have it.
Yes, I agree.
And I think we're all reassured as other people struggle that makes us feel better about our own struggles.
Follow. Not doing. It's all typed out. I had it all typed out. All I did was hit send. Hi, Mike. We're ready for you.
Hello, everybody.
Welcome back, Mike.
Thank
Yep.
you. Thank you. Okay, we will, I take it, Kimberly, there's no other items for the meeting tonight?
I just have a couple of really quick updates and then.
Oh, yes. Okay, sorry, the
Okay.
announcement? Yes.
That's okay, yes. I have just under announcements, a couple of things I just want to let the board know. As the board is aware, we have been recruiting for an executive director of the charitable foundation, and it's been a difficult recruitment process given the COVID situation. So we have put that recruitment on hold for a period of time until the middle of early next year. And we have an interim executive director. Her name is Sarah Gemsky, and she is from CCS Fundraising. We have worked with them on a number of initiatives in terms of the capital campaign. And so she has a great deal of experience in fundraising and organization development. And as you know, Angus Cochran has been wearing a number of hats. And so she is going to help and step in and be our interim executive director. She most recently was at Lucille Salter Packard Foundation for Children's Health and was working with them on the development of $1 billion philanthropic growth plan. So she's got a number of things she's going to be working with us on. So I wanted to let the board know about her, and also that we just got the most recent results from our top hat, and it looks like that we netted about $192,000, very close to that. So we did well. We had a number of people that contributed to the fund to need after some initial discussions that I know from the original numbers that we had. So I wanted to let the board know about that. And then lastly, I know Scott Hegarty, Supervisor Hegarty, has agreed to join us at the November meeting for the commendation. So wanted to those were my announcements.
Well, thank you. And that's a great job for the top hat. We got a bunch more non-operating revenue there, Chris.
Yes, we know exactly where to put it.
Okay. Well, it spends just like all other kind of money. That's all I know.
I don't care where it lives.
Yeah.
Okay. All right. At this point, we will now go into a closed session. However,
Yes.
before doing so, I want to let the public know that they have a right to know what reportable action, if any, was taken by the board during the closed session. Normally, the board would make that announcement following the closed session. As we do not know how long the closed session will last, we do not want members of the public waiting indefinitely on the phone for the board's report. Therefore, we ask that you contact the district clerk tomorrow. She will be happy to respond to any inquiries about reportable board actions. Our minutes will continue to reflect any reportable actions taken. Thank you. The board will now adjourn to a closed session.